Okay, hello. My name is Dr. Mark Awori, and I'm a children's heart surgeon. And I just want to explain to you what happens when a child has what we call a ventricular septal defect. So what I'm going to do, I'm going to draw the normal heart so that you see what that looks like. And it's just a basic drawing to give you the concept. So the heart has the 4 chambers, all right? And I'm going to draw what we call the pulmonary artery. This takes blood out of the heart to the lungs. These rectangular boxes are my lungs. I know, they don't look like lungs, okay. They are. This is the aorta. That takes blood to the body. And this is the big vein bringing blood back to the heart. So how blood goes in the normal heart is blood that doesn't have oxygen, or we call it deoxygenated, meaning the bodies use the oxygen. It goes into this upper chamber, we call that the right atrium, through the valve, that's called the tricuspid valve, then into the lungs. In the lungs, the blood collects oxygen, which your body needs. So then the blood comes back around to the heart. That's the left atrium, through the mitral valve, and then into the aorta. And this blood, the aorta has branches. It takes blood up to the head, H up there, H for the head. And once the blood has gone to the body uses the blood, or the oxygen in the blood. And so the blood comes back with a lower level of oxygen back to the right side of the heart, okay? So this is N for normal heart, all right? Now let's see what happens when a baby has a VSD or a child has a VSD. So we draw the heart again, okay? And then I'm gonna ask you whether you can spot the changes that happen, all right? You're gonna see some changes, and then we'll see whether you can spot them, okay? This is the drawing, and then tell me whether you can see the changes. The lungs are there, the aorta with its vessels going up there, the big vessels that bring blood back. So then what happens is, let's see how the blood travels in a baby with a VSD, all right? But before I show you that, X, you see this gap here? There's a gap between there and there. This X marks where the VSD is. So let's see how the blood goes. It comes into the, I'll get blue blood, comes into the, that's the right atrium, goes through the tricuspid valve into the right ventricle, then it goes into the lungs, all right? Gets oxygen, just the same as before, okay? And so it's coming back red with, that means oxygen in the blood, to the left atrium, through the mitral valve, just to the aorta like before, taking blood to the head there, to the body there, and then it comes back. The body and the head, they use the blood, or they use the oxygen in the blood, and so the blood's coming back with a lower level of oxygen. That's why it's blue, okay? But can you see what happens? There's this X, which is the gap. That's the VSD, all right? So I'm just gonna point that to you so you can see. We'll use green. That is the VSD, okay? Now what happens is, because there's higher, the pressure on this left side of the heart where the red blood is higher than on the right, some blood goes through that VSD into the lungs. So this causes 2 problems. You have too much blood going to the lungs, so the lungs are kind of soggy. So what happens to the baby, with this sogginess, they are prone to chest infections, pneumonia that is. And so a baby or a child may present with a lot of pneumonia or frequent pneumonia. Of course, that's a risk to his or her life. But the second thing is, because blood that should have gone to the body goes to the lungs, the body doesn't get enough oxygen and nutrients, and the child just doesn't grow, so not putting on weight. So the end result is a child who doesn't grow well, doesn't put on weight well, and tires easily, and has lots of or frequent chest infections. So this is the problem. In another video, I'll talk about how we solve this problem. So bye for now.